Hi, my name is Ashley. I'm a nurse at this hospital. I've worked here for 4 years and I'm working on my master's degree currently. Um, Today I'm going to overview a healthcare policy issue that affects our acute care staff. It's had extensive effects on patients, nurses, and the hospital as a whole. This issue lies with our telehospitalists and the many negative effects that it has portrayed onto our patients in our setting. There is benefits to having telehospitalists in some cases. They facilitate the delivery of care, aid in underserved regions, and facilitate shortcomings due to geographical barriers, which we have all of those in this tiny little town in the Upper Peninsula of Michigan. However, in an inpatient acute care setting, it has its drawbacks. It erodes the face-to-face interactions that you get with the doctor-patient relationship, which decreases patient trust, and there's also huge barriers to communication that we've seen in terms of language barriers, but not only language barriers. A lot of our patients struggle to hear the doctor on the TV, on the computer, without having them face-to-face, being able to read their lips. Another large negative impact that this has is the doctor can't get a in-person feel for these patients, and a lot of times they are really sick. Being able to use all your senses and pick up on nonverbal cues is very important in this setting, and right now all of that is being relied on by the nurse. Another aspect, a negative aspect of having a telehospitalist is the risk for a cybersecurity breach. Recently, a lot of hospitals in our region have been hacked by cyber attacks, and their whole internet system has went down. And in that case, we wouldn't have a doctor. So having patients here and then having to facilitate a transfer for them, essentially, because there would be nobody to take care of them other than the nurses, and we could have an ER doctor come up, but it would be catastrophic for us. Things that nurses can do as of now to ensure that the patients are being cared for. Address all questions that the patients or you have with the doctor when the doctor's right there. Ensure that you're doing a thorough head-to-toe assessment with the doctor in view. Any sort of cues non-verbally that you pick up on, make sure you portray those to the doctor. We have to make sure that the technology is enhancing the patient care as opposed to retracting from patient care, and advocate for that strongly. In the meantime, we can further our education in terms of evaluating patients and what to do in extreme situations, practice what to do in codes, how to facilitate getting the computer to the room to help run the code, maybe trying to have a backup in-person doctor for medical emergencies or any sort of second guess situation. Frequently report any sort of incidents where the telehospitalist has shortcomings. Make sure that your department head knows right away. With frequent reporting can make the change. We need to ensure that that's being done. In conclusion, with frequent reporting, advancing our education, nurses can advocate for their patients and the potential shortcomings that come from having a telehospitalist in an acute inpatient setting. Attending policy-making meetings, speaking for your patients, advocating as much as you can is what's going to help make the change. And that is all. Thank you.